What if I told you that a vitamin you trust every single day could quietly stop working because of a medication you didn't think twice about? And what happened to one of my patients will completely change how you look at your supplements. He was a 72-year-old man, careful about his health, taking his vitamins regularly, especially B12. He had heard it supports energy, nerves, brain health, so every morning, without fail, he took his B12 supplement. And yet, something didn't make sense. He still felt tired. His legs felt weak. Sometimes, a strange tingling sensation in his feet. At first, he ignored it. Maybe it's just age. But what happened next raised serious concern. His symptoms slowly worsened. Balance issues, fatigue, mental fog. And this is where most people make a dangerous mistake. They assume, if I'm taking the supplement, I must be getting the benefit. But that's not always true. Welcome to Dr. Danzy Senior Health Tips. I'm Dr. Danzy, and today I'm going to reveal something very important, especially if you are taking vitamin B12, because there are two very common medications that can silently block its effect, and most seniors have no idea. Let me explain something very simple. Vitamin B12 is essential for your body. It helps with nerve function, red blood cell production, energy levels, and even memory. But here's the catch. Your body doesn't just need B12, it needs to absorb it properly. And absorption is where things go wrong. Now imagine this. You are taking B12 every day, but your body is only absorbing a fraction of it. The rest, wasted. And over time, a deficiency begins to build, even though you're doing everything right. Now here's the myth we need to break. If I take a B12 supplement, I'm safe. No, because absorption matters more than intake. A study of over 2,000 older adults found that nearly 30–40% of seniors had low B12 levels, despite taking supplements. Let that sink in. You can be taking it and still be deficient. Now let's go back to that patient. We looked deeper into his routine. Diet was fine, supplement was regular, but then we noticed something important. He was taking a common medication for acidity every single day. And this is where things started to connect, because certain acid-reducing medications can interfere with B12 absorption. Why? Because your stomach acid plays a key role in breaking down B12 from food and helping your body absorb it. When that acid is reduced, B12 absorption drops, slowly, silently, over time. Now imagine this. You're protecting your stomach, but unintentionally affecting your nerves, your energy, your brain, and you don't even realize it. Now let me ask you something honestly. Are you taking medication for acidity or reflux regularly? Because that one habit could be affecting your B12 levels. Now here's what we did for that patient. We didn't stop his medication suddenly. That would be unsafe. Instead, we adjusted timing, we reviewed the necessity, we improved his diet, and we changed the form of B12 he was taking. And what happened next was powerful. Within a few weeks, his energy improved, the tingling reduced, his balance became better, and for the first time, he felt like the supplement was actually working. Now let's go deeper, because there's another common medication that creates a similar problem, and this one is even more widespread. One of my patients, a 70-year-old woman, was managing her blood sugar carefully. She was on regular medication, disciplined, consistent. But she started noticing something strange. Fatigue, memory lapses, numbness in her hands. Again, she thought it was age. But this is where most people miss the connection, because some blood sugar medications can also reduce B12 levels over time. Not immediately, but gradually. And since symptoms appear slowly, they are often ignored. Now imagine this. You're controlling your sugar, but slowly losing your B12. And the effects show up as weakness, nerve discomfort, cognitive changes. Now here's the reality. It's not about stopping your medication. It's about awareness. because once you know this, you can monitor it. You can test your levels. You can adjust your supplementation properly. Now let me ask you something. Have you ever checked your B12 levels, or are you just assuming everything is fine? Because assumptions can be dangerous. Now here's something important. Symptoms of low B12 are often subtle. Fatigue, mild confusion, tingling, balance issues, easy to ignore, easy to misinterpret, but over time, they can become serious. Now imagine catching it early, instead of dealing with long-term damage. That's the difference awareness makes. Now before we continue, if you want simple, practical health insights like this, make sure you subscribe to Dr. Danzy Senior Health Tips, because here, we don't just talk about what to take, we help you understand how your body actually works. Now in the next part, I'm going to reveal something even more surprising, because there's a specific way to take B12 that most people get completely wrong, and what happened to one of my patients when we corrected just this one mistake will shock you. Stay with me, because what you learn next might completely change how your supplements work. Now this is where things get even more surprising, because even if you're not taking those medications, even if your B12 levels look normal, there's a high chance you're still taking it the wrong way. And what happened to one of my patients because of this mistake will completely change how you take your supplements. She was a 70-year-old woman, very careful about her health. She took her B12 regularly. Same time every day, same dosage, never missed a dose. And yet, she still complained of fatigue, low energy, occasional numbness in her fingers. When we checked her reports, her B12 levels were technically within range, so everything looked fine on paper. But her symptoms told a different story, and this is where most people get misled. They trust the number, but ignore the body, because normal doesn't always mean optimal. Now this is where things get interesting. We didn't change her medication, we didn't increase her dose. We changed one simple thing, how she was taking B12, and what happened next was something she didn't expect. Within a few weeks, her energy improved, her symptoms reduced, and she finally felt the difference. So what was the mistake? Timing and method. Most people take B12 like any other vitamin, swallow it quickly, with other pills, often with food. But here's the truth. B12 absorption is sensitive, especially in seniors. When taken with heavy meals, absorption can be reduced. When taken with multiple medications, it can compete for absorption. And when swallowed immediately, some forms don't get enough time to be properly utilized. Now imagine this. You're taking the right supplement, but your body is only using a part of it. Now here's the myth we need to break. As long as I take my vitamin, it will work. No, because how you take it determines how well it works. A study of older adults found that absorption efficiency varied significantly, based on timing, form, and method of intake. Let that sink in. Same vitamin, different results, based on how you use it. Now let me explain the correct approach. First, take B12 on a relatively empty stomach. This helps improve absorption. Second, avoid taking it with a large group of medications. Give it some space. Even 30-60 minutes can make a difference. Third, if you're using a sublingual form, let it dissolve properly under the tongue. Don't rush it, because absorption begins there. Now think about this. Instead of just taking your supplement, you're allowing your body to actually use it. Now let me ask you something honestly. How do you take your vitamins? Do you rush through them, or do you give your body time to absorb them? Because that small difference can completely change the outcome. Now let's go deeper. There's another mistake. And this one is extremely common. Taking B12 only after symptoms appear. One of my patients, a 74-year-old man, came in with severe fatigue, numbness in his feet, difficulty walking steadily. When we tested his B12 levels, they were very low, and the problem? He had ignored early signs for months because they were mild. And this is where most people delay action. They wait for symptoms to become serious, but B12 deficiency develops slowly, and early symptoms are subtle. easy to dismiss. Now imagine catching it early, instead of waiting for it to affect your nerves. That's the difference awareness makes. So we started supplementation properly, adjusted his routine, monitored his progress, and what happened next? Within weeks, his energy improved. Within a few months, his balance became better. But here's the truth. If he had acted earlier, recovery would have been faster. Now think about this. Your body gives signals, small ones, quiet ones, but they matter. Now let's connect everything so far. It's not just about taking B12, it's about understanding absorption, being aware of medication interactions, taking it the right way, and acting early. These are the things that make the real difference. Now, before we move to the final part, if you're starting to realize how small mistakes can affect your health, make sure you subscribe to Dr. Danzy Senior Health Tips, because here, we don't just give information, we give clarity. Now stay with me, because in the final part, I'm going to reveal something most people never consider. There's a situation where even B12 supplements may not be enough, no matter how well you take them. And what happened to one of my patients because of this will completely change how you think about deficiency. Don't miss this, because this final piece could be the one thing you've been overlooking, is something most people never expect. Because even if you take B12 correctly, even if you avoid those medications, even if you follow everything perfectly, there are situations where your body still won't get enough. And what happened to one of my patients because of this was a turning point we could not ignore. He was a 75-year-old man, very disciplined, by the book. He followed every step we discussed, right timing, right method, no conflicting medications. And still, his symptoms didn't improve. Fatigue stayed, numbness remained. Balance issues slowly got worse. And this is where most people feel stuck. I'm doing everything right, so why isn't it working? So we looked deeper, not at his routine, but at his body's ability, and that's when we found the real issue, absorption failure. In some seniors, the stomach stops producing enough of a substance called intrinsic factor. This is essential for B12 absorption. Without it, no matter how much B12 you take, your body cannot absorb it properly. Now imagine this. You're taking the right supplement, at the right time, in the right way, and still, your body is not receiving it. That's frustrating, but more importantly, it's dangerous if ignored. Now here's the myth we need to break. If supplements don't work, I just need a higher dose. No, because the issue may not be the dose, it may be the delivery. A study involving older adults showed that a significant percentage of seniors with persistent B12 deficiency had impaired absorption due to reduced intrinsic factor, which means oral supplements alone were not enough. Now let that sink in. Sometimes it's not about what you take, but how your body processes it. Now let's go back to that patient. Once we identified the issue, we didn't keep increasing his tablets. We changed the approach. We used an alternative method that bypassed the usual absorption pathway. And what happened next was something he hadn't experienced in months, within weeks. His energy started returning. The numbness reduced. His walking improved. And for the first time, he felt real progress. Now think about this. Same nutrient, different delivery, completely different result. Now let me ask you something honestly. If something isn't working, do you just continue it blindly or do you look deeper? Because that decision can change everything. Now let's go even deeper. There's another hidden risk. Many seniors assume if symptoms are mild, it's not serious, but B12 deficiency affects your nerves, and nerve damage can become permanent if ignored for too long. One of my patients, a 70-year-old woman, delayed action for months, mild tingling, occasional weakness, nothing alarming, until it progressed, and recovery became slower. Now imagine catching it early. Instead of dealing with long-term consequences, that's the power of awareness. Now let's bring everything together. If you're taking B12, you need to remember this. It's not just about taking it, it's about understanding interactions, avoiding common medication conflicts, taking it the right way, monitoring your levels, and knowing when your body needs a different approach. Because real health comes from understanding your body, not just following routines. Now imagine this. You apply everything you learned today. You become aware, you adjust, you monitor. Within weeks, you feel the difference. Within months, you gain confidence in your health. And most importantly, you avoid silent problems before they become serious. Now, before we close, I want to ask you something. Are you taking B12 right now? And if yes, have you ever checked how well it's actually working for you? Comment below and share your experience. And tell me, have you ever felt fatigue or tingling even after taking supplements? Your answer might help someone else. And if you found this helpful, make sure you subscribe to Dr. Danzy Senior Health Tips, because here, we don't just tell you what to take. We help you understand what truly works. I'm Dr. Danzy, and I'll see you in the next video.